Welcome back to AM Northwest. What happens when the pain you're feeling never goes away, when its cause is not easily diagnosed and no treatment seems to work? Well, here to tell us how the nerve pathways in your brain may be to blame, we welcome back from the Association for Treatment of Neuroplastic Symptoms, Dr. David Clarke. Good to see you again, doctor.
Great to be back with you.
So you talk about 1 in 6 adults suffer some kind of chronic pain or illness, right? That's not medically explained.
Yeah, actually we found in a recent national survey that it's more like 1 in 4.
Oh, wow.
And possibly even more than that. Yeah, we did a representative sample at my nonprofit, and we found that 1 in 4 had physical symptoms, pain or illness, not explained by organ disease or structural damage, and that another 1 in 4 had a diagnosis, but they weren't responding to treatment the way their doctor expected. Many of them also are going to have one of these neuroplastic conditions where the brain is causing symptoms in the body, very real symptoms, but not explained by organ disease or structural damage.
Give me an example of someone.
Fibromyalgia, migraines, dizziness, ringing in the ears, visual disturbances, irritable bowel, long COVID, chronic fatigue. And the symptoms are every bit as severe as those caused by other forms of illness. My personal record patient had unexplained abdominal pain for 79 years.
Oh my gosh.
She was successfully treated by finding the underlying stress and working with that.
How do you treat that though? So you find that they had childhood trauma multiple times, right? Then how do you treat that?
Well, we help people recognize the impact that it's had on them.
Okay.
It can be almost anything that would make you feel less about yourself as a person, any experiences you had as a kid that you would never want for a child of your own, for example. And the long-term impact of that is what we can treat. These are personality traits like people-pleasing or being excessively self-critical or being the kind of person that is always working on behalf of others in your world, but never putting yourself on the list of people you take care of.
Wow.
Those kind of things create a lot of stress for people that can happen well into the adult years.
Yeah.
And we can work with that. We can help people make changes in that, bring the stress level down, and we see the physical symptoms improve in parallel with that.
Well, that makes me think, would therapy work?
Yeah, absolutely.
Okay.
Many people need therapy, but on our website, symptomatic.me, we've got lots of resources for people short of therapy that can be highly effective.
Okay.
Starts with a self-assessment quiz that takes less than 3 minutes.
Okay.
But we've got recordings, we've got books that are science-based, lots of research on this now. We have an annual conference where the leading researchers in the world give presentations. Those are all recorded. So lots of things that people can use to help themselves.
You talk about saying consider your medical history.
Yeah, very important to get a medical evaluation to make sure you don't have an organ disease or structural damage.
Okay,
but
gotcha.
if you don't, then it's important to look for this brain to body condition because that can cause exactly the same kinds of symptoms.
Right. Examine the role of stress in your symptoms.
Yeah, looking at stress in your life right now, can you find anything that seems to correlate chronologically with when your symptoms go up and down? So one of my patients that baffled a major university for 15 years, it turned out that her symptoms would go up when she got a phone call from her abusive mother or when she was driving to go and visit her mother. That would trigger her symptoms, but she never connected it because she wasn't looking for that kind of relationship.
Wow. Okay. And then you say to educate yourself about new treatment options.
Yeah, we've got research now from leading centers across North America, everywhere from Halifax to Los Angeles, that shows that the new neuroplastic recovery therapies are highly effective. The study in Boulder, Colorado, for example, of people with back pain for an average of 10 years, with 1 month of treatment, the symptoms came down by 75%. These are all on our website, symptomatic.me, and you can get connected to those and find relief often for the first time.
Is there a timeline about how soon you could find relief? Like,
yeah, everybody's different.
Oh, yeah, it makes sense.
One of my patients, that same one who baffled the university, they had no idea why she was having her attacks of dizziness and vomiting. She was cured in less than an hour.
What?
Yes, but just by finding out that it was all connected to her abusive mother. Other people they need years of psychotherapy, to be honest. So there's a spectrum. There's no single pathway to this. But even the people who are going to need the longest time, at least they know they're on the right pathway at long last.
Right. Oh my gosh, so much to talk about, but we want to tell everyone that we'll have more information about Dr. David Clarke, and also your surveys and the information that you have on our website at ka2u.com. Dr. Clarke, thank you very much.
Thank you.
All right, we'll be right back with more AM Northwest. Don't go away.